Hey everyone, Dr. Janelle Louis here, naturopathic doctor and author of Optimize Your Body, Heal Your Mind. I just wanted to make a really quick video to talk to you guys about the connection between mental health and gastrointestinal inflammation. So essentially in your gastrointestinal tract, you have a very significant portion of your immune system. Up to 70% of your immune system is housed in your GI tract. And then you also have a significant portion of the nervous system located in the GI tract. The GI tract actually contains 200 to 600 million neurons. So for perspective, that's about the amount of neurons that are located in a cat's brain or a small dog's brain. So you can see that we have a really big portion of our nervous system located in the GI tract. So it's easy to see from that perspective how mental health would be connected to immune system health, which is also then connected to gastrointestinal health. But let's talk a little bit more about the basics. How do we really know that there is a connection? Well, research shows that people with mood disorders, specifically major depressive disorder or various forms of depression, and people with bipolar disorder have higher levels of a blood marker called C-reactive protein. C-reactive protein is an acute phase reactant, so basically it rises in the blood when your body has high amounts of inflammation. So people with major depression and people with bipolar disorder have higher levels of CRP than people who do not have these conditions. And so you may be wondering, okay, basically you're saying that people with these conditions have higher amounts of inflammation. What does that have to do with the gastrointestinal tract? Well, I recently had a patient and I checked CRP on this patient. This is something that I do pretty routinely with all of my patients, or the majority of my patients. And so I checked CRP, and this patient's CRP was significantly elevated. It was very high. And so I also checked for, I was searching for the source of this inflammation. Because if you understand, CRP is not a specific marker. So basically what I mean by that is it tells you that there's inflammation present in the body, but it doesn't tell you where that inflammation is coming from. So I checked for autoimmune diseases. So I checked ANA, rheumatoid factor, and anti-CP, which would be basically checking for rheumatoid arthritis, lupus, scleroderma, all of these type of rheumatological autoimmune diseases. I checked for autoimmune thyroid diseases, so Hashimoto's thyroiditis. I checked for, this patient also had symptoms of, hair loss, things like that. So I was thinking that an autoimmune thyroid disease was a possibility. And so she also had muscle pain, joint pain. So I actually was searching for an autoimmune disease at this point. And so no thyroid antibodies, so no signs of Hashimoto's or Graves' disease. Her thyroid, her TSH was actually beautiful, so her thyroid function was very, very good. I talked to her about oral hygiene. She, she mentioned that she had problems with gum inflammation in the past, and she saw a specialist for that, but she didn't have any active infections at that time. So that wasn't necessarily contributing to the CRP. I talked to her about, she did have a slight degree of insulin resistance, but it wasn't enough to where I would expect to see such a high CRP. So we ended up doing a stool test to kind of see what's going on in her gastrointestinal tract. And this patient came back with significant dysbiosis. So what I mean by that is we all have microbes in our GI tract. So we have bacteria, sometimes viruses, protozoa, things like that, parasites, worms, lots of different microbes in our GI tracts. Some should be there and some should not be there. And so as far as the normal microbes, the microbes that should have been there, she had abnormal values. So she had abnormal amounts of normal microbes. She also had abnormal amounts of abnormal microbes. So there was significant dysbiosis. Something was going on in her GI tract. Her calprotectin, which is a marker of gastrointestinal inflammation, was significantly elevated, to the point that I was concerned about inflammatory bowel disease. And even though she didn't actually report many gastrointestinal symptoms, which is key here, and it's very interesting. And so with the CCP being high, I'm reasonably sure we're going to do additional testing to check for inflammatory bowel disease like Crohn's disease and ulcerative colitis, but I'm reasonably sure that her CRP, I'm not sure if I said CRP or CCP a few seconds ago, but what I mean is CRP. I'm reasonably sure that her CRP is elevated because of her high amounts of gastrointestinal inflammation. So you can see how a person could have significant dysbiosis in the GI tract that's contributing to an elevated CRP. And then we just talked about how research shows that people who experience mood disorders have higher amounts of CRP. So this is I'm trying to paint a picture here, and I'm hoping that you're following me, of how dysbiosis or an abnormal or high amounts of inflammation in the GI tract can contribute to, or can be a sign of, mental health concerns, mood disorders specifically in this case. And so I told you that story about my patient because I want you to understand that high amounts of inflammation, I keep saying it, I'm going to keep saying it, high amounts of inflammation in the GI tract can negatively impact mental health. And we believe that this, I'm not just making this up, there's lots of research on this. And we believe that this is because of the effect that inflammatory cytokines, which are the chemical messengers that are released in the body. So inflammatory cytokines have a direct effect on neurotransmitters like serotonin, dopamine, and norepinephrine. So specifically those monoamine neurotransmitters. And we also believe that it could be a few different reasons, but that's one of our theories, that the inflammatory cytokines have a specific direct effect on monoamine production. And we also believe that it could be due to HPA axis dysregulation. So you're going to hear me talk about the HPA axis more and more, because it's highly implicated in adverse childhood experiences, so in trauma. But right now I'm talking about it from the broader perspective of stress. So the HPA axis basically is you could call it a pathway, but basically what it is that there's a region of the brain called the hypothalamus, and the hypothalamus sends messengers, you could say, to the pituitary gland, which then sends, again, you could say messengers, to the adrenal glands, and that's basically how our stress response takes place. So those are the two reasons that we believe that high levels of inflammation, those are kind of the mechanisms by which we understand that high levels of inflammation can negatively impact mental health. And I really wanted to talk to you guys about that, because what's key with my patient that I mentioned is that she is not reporting gastrointestinal symptoms, and yet the objective measures, so her fecal calprotectin is significantly elevated, to the point that I'm actually concerned about Crohn's disease or ulcerative colitis. This is a high level of inflammation. You understand what I'm saying? And yet she's not reporting symptoms. So gastrointestinal health is so key to mental health, even if a person is not experiencing gastrointestinal symptoms. I can't say that enough. Even if a person is not experiencing gastrointestinal symptoms, their poor gastrointestinal tract health could be contributing to mental health concerns. So I really wanted to talk to you about that. I'm going to basically, I don't really like to point out a problem without giving a potential solution. So I'll tell you what I usually recommend for my patients when, their labs come back like that. I recommend an elimination and challenge protocol. So what we're doing with the elimination and challenge protocol is we are switching to a highly anti-inflammatory diet, cutting out all inflammatory foods, and slowly reintroducing them based on, so go for 4 weeks on a highly anti-inflammatory diet. Basically, I'm talking about a primarily plant-based diet. And if you want more information on that, I can tell you exactly why I do that, but there's lots of research that suggests that animal proteins, such as are found in eggs, in meat, in dairy, things like that, can significantly alter the microbiome. And it increases the production of a specific microbe called Bilophila wadsworthia. And Bilophila wadsworthia is a microbe that is highly associated with, significantly associated with inflammatory bowel disease. So basically, that particular bacteria can increase gastrointestinal inflammation. So this is why I recommend a 4-week plant-based elimination and challenge diet, and then patients reintroduce afterwards, after those 4 weeks. And actually many of my patients, most of my patients, I'll say, start off thinking, how on earth am I going to do this? And then by the end of the 4 weeks, most of my patients, the ones who take it seriously, let me say that, I'm going to be real with you, the ones who take it seriously, they report that they feel so much better that they actually, they want to hold on to certain aspects of the elimination and challenge diet, and they want to start eating that way, especially my patients with autoimmune diseases and mental health concerns. So that's what I have for you guys today. I wanted to talk to you briefly just about gastrointestinal inflammation, gastrointestinal health overall, and its connection to mental health. If you have any questions, as always, leave it in the comments below, and looking forward to my next video. I'm going to make another video talking about specifically the microbes and how they affect mental health. So this is part 1 of gastrointestinal health and mental health. I'm going to make another video talking about the microbes and probiotics, prebiotics, things like that. So look out for that video, and until next time.